Have you ever felt like your brain just won't switch off, even when nothing is actually wrong? Like your heart races, your chest feels tight, your stomach twists, and your thoughts spin in circles for hours? Anxiety isn't just worrying too much or being sensitive. It can feel like your nervous system is stuck in alert mode, even when you logically know you're safe. And the most confusing part is this: people on the outside may think you're fine, while inside your mind and body feel like they're fighting a storm. In this video, we're going to talk about anxiety in a way that is calm, respectful, and clear. We'll explore what happens in the brain, why anxiety shows up in the body, the different types of anxiety disorders, and practical coping tools that real therapists use. If anxiety has ever made you feel misunderstood, weak, or not normal, stay with me. You deserve answers, you deserve clarity, and you deserve to know that anxiety is common, manageable, and treatable. Let's begin. Anxiety is a natural human response. It exists to protect us. When our brain thinks we're in danger, it activates the body's alarm system so we can react quickly. That's useful if a real threat is present. But for millions of teenagers and adults around the world, this alarm system becomes overactive. It turns on when there isn't real danger, or it stays switched on far longer than it should. That's when normal anxiety becomes an anxiety disorder. In this video, we will go beyond simple definitions and stereotypes. We're going to understand anxiety as a mind-body condition involving the brain, nervous system, thoughts, emotions, and behavior. We will discuss how anxiety can affect school, work, relationships, sleep, and confidence. We will also talk about strengths people with anxiety often have, like empathy, awareness, and deep thinking. Most importantly, you will learn practical coping tools that can help reduce anxiety and bring your nervous system back toward calm. This video is educational and supportive. It is not meant for diagnosis, but to help you understand yourself or someone you care about in a kinder way. To truly understand anxiety disorders, we need to understand the science of how anxiety works in the brain. When your brain senses danger, the amygdala, your emotional alarm center, activates your fight, flight, or freeze response. This response triggers stress hormones like adrenaline and cortisol. Your heart beats faster, your breathing changes, your muscles tense, and your attention narrows. All of this is designed to help you survive. That means anxiety is not weakness. It is the body trying to protect you. In anxiety disorders, this system becomes overly sensitive. The brain misinterprets harmless situations as dangerous. Social interactions, exams, crowds, or even your own thoughts. You may logically know you're safe, but your nervous system doesn't feel safe. This mismatch is why anxiety can be confusing. Your body reacts as if danger is present when there is none. This is also why anxiety has physical symptoms. Anxiety is not just in your head. It lives in the body as well. Fast heartbeat, shaky hands, sweating, stomach discomfort, dizziness, and difficulty concentrating are all common anxiety responses. They can be uncomfortable, but they are part of the body's protective design. Understanding this often reduces fear, because symptoms start to make sense. It's important to understand the difference between normal stress and anxiety disorders. Everyone feels anxious before an exam, job interview, sports performance, or important decision. That anxiety usually goes away when the situation ends. Anxiety disorders are different. Anxiety becomes intense, lasts longer than expected, shows up without clear reason, or interferes with daily life. It may affect sleep, school performance, work productivity, relationships, or the ability to relax. People may avoid situations that trigger anxiety, which can shrink their world over time. Anxiety disorders are not personality flaws, and they are not caused by lack of willpower. They are real psychological conditions influenced by genetics, environment, learning history, and neurobiology. Recognizing when anxiety becomes overwhelming is important because effective help exists. Therapy, coping tools, lifestyle changes, and sometimes medical support can significantly reduce anxiety and improve quality of life. Anxiety comes in different forms. Understanding these forms helps people feel less confused and more validated. Generalized anxiety disorder involves persistent worry about many areas of life: health, school, work, relationships, future plans, responsibilities. The worry is difficult to control and often accompanied by restlessness, tension, fatigue, and difficulty concentrating. People with GAD often say, "My brain never quiets down." Panic disorder involves recurrent panic attacks. A panic attack is a sudden surge of intense fear with strong physical sensations such as heart racing, trembling, sweating, chest tightness, and feeling out of control. Panic attacks are frightening, but they are not dangerous. Panic disorder also often includes fear of having another panic attack, which can lead to avoidance of certain places or situations. Social anxiety disorder involves intense fear of being judged, embarrassed, or negatively evaluated in social situations. People may avoid speaking in class, answering questions, talking to strangers, eating in public, or being the center of attention. Social anxiety is not shyness. It is a powerful fear response. Specific phobias involve intense fear of particular objects or situations, such as certain animals, flying, heights, closed spaces, or needles. The fear may be disproportionate to the actual danger, but it feels very real to the person experiencing it. Conditions like obsessive-compulsive disorder and post-traumatic stress are related but distinct. They involve anxiety, but they also have additional features and should be understood carefully and compassionately. They are real conditions, treatable with professional support. Anxiety disorders affect far more than occasional nervousness. They influence how people think, feel, act, and live. Many individuals experience overthinking or rumination, replaying scenarios repeatedly in their mind, imagining worst-case outcomes, or seeking constant reassurance. This can be exhausting. Avoidance is another common pattern. To avoid discomfort, people may skip social events, delay tasks, avoid conversations, or stay quiet to prevent embarrassment. Avoidance provides short-term relief, but it strengthens anxiety over time because the brain never gets a chance to learn that the situation is actually safe. Anxiety affects sleep, often causing difficulty falling asleep due to racing thoughts. It also affects concentration, making it hard to focus in school or work settings. Physical symptoms such as headaches, stomach discomfort, muscle tension, and fatigue are common. Anxiety can impact self-esteem, causing people to doubt their worth or abilities, even when they are capable and intelligent. Although anxiety can be challenging, people who live with anxiety often develop meaningful strengths. They tend to be empathetic because they know what emotional pain feels like. Many are observant and sensitive to others' feelings. They often think deeply, prepare thoroughly, and care genuinely about doing well. These qualities can become powerful strengths when anxiety is managed. The goal is not to erase anxiety completely, but to regulate it so it no longer controls decisions or limits life. Now let's talk about coping tools. These are not magic tricks or instant cures. They are science-based strategies used in therapy to support nervous system regulation. Slow, steady breathing with slightly longer exhales helps signal safety to the body. You are not forcing relaxation, you are inviting it. Gentle breathing can reduce the intensity of anxious sensations over time. Grounding brings attention back to the present moment. This may include noticing 5 things you can see, 4 you can feel, 3 you can hear, 2 you can smell, and 1 you can taste. These exercises anchor the mind in the present instead of spiraling into what-if thoughts. Light movement, stretching, walking, and regular sleep routines support the nervous system. These do not cure anxiety, but they strengthen emotional resilience. Avoidance keeps anxiety strong. Gently and gradually facing feared situations with support helps the brain relearn safety. This process should be done at a comfortable pace and, when needed, with professional guidance. Learning to question anxious thoughts instead of automatically believing them can be very helpful. Writing them down, examining evidence for and against them, and replacing them with more balanced thoughts is a core strategy in therapy. Therapy approaches such as cognitive behavioral therapy and mindfulness-based therapies are widely used and supported by research. Medication can also be helpful in some cases when prescribed and monitored by qualified professionals. None of these are signs of weakness. They are forms of care. Anxiety disorders are highly treatable. Millions of people learn to manage anxiety, reduce symptoms, and live fulfilling lives. The brain is capable of change. With knowledge, tools, and support, anxiety becomes understandable instead of mysterious and overwhelming. You are not broken, alone, or beyond help. You are a human being whose nervous system needs understanding and care. If this video helped you understand anxiety disorders more clearly, remember that knowledge is the first step toward healing. Anxiety is not a personal failure. It is a nervous system pattern that can change with the right tools and support. Be kind to yourself, be patient with your progress, and know that you deserve calm and safety. If you found this useful, please like the video, share it with someone who might need it, and subscribe to the channel for more content on anxiety, mental health, and emotional well-being. Your support helps this information reach more people who may be struggling silently. Thank you for watching, and take gentle care of yourself.